Hello viewers, a few words on endometriosis and how it impacts fertility. Most of us are aware that endometriosis is a deadly disease which kills the ovaries and the adjoining organs and decrease the fertility potential and also the quality of life that the girl lives. So why does endometriosis occur? Most of the time we have seen it to be an ethnic problem wherein a group of patients from a particular ethnicity suffer this issue while the others from a different group or an ethnicity don't. So what happens to cause endometriosis is there are lots of theories put up, but the very common issue what we see is either they have a retrograde flow of menstruation, like when the menstruation happens, it doesn't happen from the uterus to the outflow tract through the vagina outwards. There's a retrograde flow of the menstruation from the uterus to the fallopian tube that it seeps into the peritoneal cavity. And two, we also have various implantation theories, like there could be presence of endometrial glands anywhere else in the abdominal cavity, which means they can have the endometrial glands present on the ovaries, on the superficial surface of the bowel, bladder and so on. So whenever there is a proliferating endometrium, the endometrial glands in these places also proliferate and they secrete and they bleed. So when there is a bleeding, it attracts lots of organism growth leading to adhesions and so on. So most common site of implantation is seen in the ovaries. So every month these girls tend to bleed in the ovary. The blood gets collected in the ovaries, becomes an old hematoma, and following which it turns out to be a chocolate color fluid and a cyst called endometriotic cyst. So what are all the issues that happen is due to this endometriosis, they develop severe pain, menorrhagia, which could be the only presenting symptom that they had presented to us even before their marriage. And following marriage, it becomes identified due to the fertility issues that they have. So following the endometriotic issue, they can have adenomyosis wherein the uterus itself becomes bulkier and they have very painful menstruation and excessive bleeding. So there can be a distorted tubo-ovarian relationship due to the adhesions. The ovaries can become huge with endometriotic cyst, and what we find in these people is they ovulate, but the quality of the oocyte is not too good, and even if they ovulate, the fertility potential of the oocyte is low, and even if the oocyte fertilizes, the implantation potential of the embryo is quite low. So there is a challenge in the patients with endometriosis right from the process of ovulation to the process of fertilization, implantation and reproduction. So how are we going to deal with? So should we have to operate on all those patients with endometriotic cyst is very important to be discussed. What we do at our center, ARC Fertility and Research Center, is we try to do an ultrasound guided aspiration of the endometriotic cyst as far as possible, because all of us know that endometriosis is progressive, and even if we operate this cycle, there is going to be a recurrence following cycle or probably after 2 or 3 more cycles. So if they are with us for a fertility issue, we try to do an ultrasound guided aspiration and try to make them fall pregnant by ovulation induction immediately after the aspiration. If they are planning to come for an IVF or an ICSI program, we do an ultrasound guided aspiration, put them on GnRH agonist, try to suppress the ovulation and thereby the cyst formation, and then once we know the disease process is suppressed, we start the stimulation. If they present with very bad endometriomas and if they are too symptomatic, then we don't mind taking them for a laparoscopy. We do a cystectomy. We try to preserve the ovaries and the ovarian cortex with the follicles as far as possible during the laparoscopic procedure. At the same time, take care that they do not have a recurrence and put them on GnRH analogs following the laparoscopic procedure. See to that the tissue heals well, and then we start the stimulation and then preserve the embryos and later plan for an embryo transfer. So what is very essential to know in endometriosis? We have to be very careful. We have to know that it's a progressive disease. We have to know that it's going to distort the anatomy inside the abdominal cavity. We have to understand that there are going to be lots of challenges in the fertility issues, and we have to understand that they do need care even after the delivery. So it's not that they conceive, they reproduce and they're out of trouble. Most of them try to come out of endometriosis after the reproduction, but few people do continue to have issues even after that, which needs essential care and treatment. So once we come across people with endometriosis, we have to create enough awareness to them to understand that they have to be very closely attached to a treating fertility consultant for their fertility issues and plan their pregnancy as early as possible without postponing it. I think all endometriotic cyst does not require a surgical intervention, particularly for those who have had previous laparoscopies 1 or 2 times. It is like no point you jump in and say that you're going to do a laparoscopy again. So as far as possible, we have to try to be very minimally invasive, which means do not try to operate once you know that they have endometriotic cyst. Try to be very slow in your surgery, but at the same time very fast in your fertility treatment. Aspirate the cyst, take the cysts under your control, put them on GnRH analog, suppress the disease process. Once you know the disease process is suppressed, then stimulate them. So I think it is the counseling of the patient, making the patient understand about their disease process, taking the confidence of the couple and going ahead with the treatment is the best solution for endometriosis. Thank you.